I would say that my personal motto is to compete with no one and collaborate with everyone. What that means is how do we actually team up together to look for ways in which we can bring our expertise together and have collective impact.
Gail McVey is the recipient of the 2015 Tentanda Via Award, reflecting York's motto, "The way must be tried." This award is given to a graduate who has demonstrated innovative, unconventional, and daring leadership and success.
So if it wasn't for York, I wouldn't be a psychologist today, and I wouldn't be Canada's leading eating disorder prevention specialist. I discover new knowledge through my research. I then take that knowledge and translate that into practice by doing professional development and networking with different people. And then I work with policy decision makers so that we can actually have an impact on provincial curriculum so that all children and youth can benefit. In terms of misconceptions about eating disorders, I would say that people often think that eating disorders is something that happens only to girls and to women, and it's something that teenagers grow out of. And it couldn't be further from the truth. I would say that being able to raise awareness about how serious these disorders are and looking at them as we might do equally with other health issues and other mental health issues is certainly a goal for our field. The legacy or the impact that I would like to have on the area of eating disorders is for us to be able to build capacity for more prevention, more treatment, so that families and individuals with eating disorders can actually get the care that they need. I would say that my current work in research, practice, and policy stems directly from the training that I received at York University, and that to this day has continued to really inform my day-to-day practice. Clinical psychology was a big draw. So I actually was born and raised outside of Ontario, so I didn't know the Ontario university system very well. But the reputation that York University had for its clinical psychology program was very, very strong, and that was a draw for me to actually move to Toronto, and I never looked back. I was in a clinical psychology program that had a subspecialty called clinical developmental psychology, and CD is the term that we used affectionately for that program. And it was anchored in a scientist practitioner model of training. I'm very grateful because it's the training that I received at York University in this model of care is something that still informs my work to this day. One of its strengths and what it makes it unique is a very diverse student culture, very diverse faculty, and one gets the sense that the sky's the limit in terms of what you can study. Because I'm so passionate about trying to either improve the lives of children and youth or trying to effectively put my prevention research into practice, when I have challenges and so on, I keep my eye on that ultimate goal and try to push through.
Ladies and gentlemen, the recipient of the 2015 Tentanda Via Award, Gail McVey.
Thank you very much. I want to put a shout out to my tables number 3 and number 4 here who are my guests. Thank you for all of the applause. It's a great honor to be here, and I first wanted to thank Mike Leon and his team at Brand Heroes who did a phenomenal job with those videos, and you'll see the other 3 ones coming up next. And I also really appreciate the helpful assistance of Nicole Light. She coordinated multiple details behind the scenes leading up to this evening. So receiving the Bryden Award has been very much of a fun and exciting homecoming event for me, and I owe this celebration first and foremost to Bruce Bryden. So he truly embraced the Tentanda Via motto, which is the way must be tried. His school spirit and enthusiasm for the university and for the Alumni Association lives on through these awards. So I really want to thank Kathy Elliott Bryden, his wife, and their daughter Joanna, for sharing Bruce's strong school spirit with the York family and community. So my award is for daring leadership and successes. And for me, the recipe for success has 3 key features. One is a strong foundation, the other is essential ingredients, and the third is the icing on the cake, which is meeting great people along the way. So the training in clinical psychology at York, as I said in my video, provided me with a very strong foundation to launch my career. Once I entered the workforce, it became obvious that the scientist practitioner model of training gave me a leg up compared to psychologists who were trained elsewhere. York University got it right when they hired Dr. Deb Pepler, Distinguished Professor of Psychology. The students who trained under Deb have all gone on to become leaders in their fields. I'm also grateful for the female academic mentors I had at York, including Dr. Joan Stewart at the undergraduate level, as well as Dr. Maxine Winter at the master's level. And it's very fitting to have Harvey Skinner, our Dean of the Faculty of Health at York, sit with me here tonight, as he was the one who facilitated my academic appointment at the university, and that launched my research career as an independent investigator. The essential ingredient for me is adopting a collaborative research and a collaborative approach to my research and to my practice. So wearing one of my hats, I oversee a provincial training program in eating disorders here in Ontario. This has led to the development of a very coordinated network of specialized eating disorder services. We started with one publicly funded eating disorder program in the 1980s, and we've grown to 38 programs. And this network is a first of its kind, not only in Canada, but across the world. It's not the outcome of one person's leadership, but rather the result of a group of very dedicated clinicians and healthcare practitioners who I'm very proud to call my colleagues. We have a close-knit group of professionals who carry out important clinical work in all pockets of this province. And we also have Catherine Ford from the ministry to thank for to help us with the expansion across the province. Wearing my other hat as a scientist, my prevention research is heavily supported by my public health colleagues. They are experts at working in the community and in schools. We have collaborated to find out if the prevention and health promotion strategies that we just developed together are helpful and effective. But we've also worked together to find creative and innovative ways to sustain these health promotion efforts long after research funding has lapsed. So this is a key issue, as Canada has the reputation for being a country of pilot studies based on short-term funding opportunities. So the creativity and innovation that goes into research and development gets lost over time if careful attention is not given to carefully thought-out implementation planning. The icing on the cake is meeting great people along the way. My invited guests, apart from my husband, who are all women tonight, joining me this evening, have collectively held positions as scientists, scholars, clinicians, including psychologists and future psychologists, senior policy decision makers, CEOs, COOs, and eating disorder advocates. Such a strong and impressive group of women whom we have in our midst here this evening, a few of them who are York graduates themselves. The four individuals who supported my nomination for this award come from diverse professional backgrounds. One is a health promotion specialist who works in public health. One is a child and adolescent psychiatrist who works in a teaching hospital in the treatment of eating disorders. One is a distinguished professor of psychology in the US and internationally known for his area of prevention of eating disorders. And of course, Deb Pepler, my PhD supervisor, who was world-renowned for her expertise in bullying prevention. This diversity is representative of my work as a health systems research scientist at Sick Kids. I work within and across systems. This includes the education system, the public health system, the hospital and community-based healthcare systems, sports and recreation. My work involves collaborating across these systems to encourage people to work together. The health topic that I study is eating disorders, but I'm most intrigued at finding ways to offset their onset. When I first started working in eating disorders, there were only adult services available back in the 80s. A quick study revealed that individuals who were seeking treatment for the first time were on average 26 years of age, yet many had had their symptoms for 7 to 13 years. The logical step was to build capacity for adolescent services. And today we are seeing children as young as 7 and 8 years of age, males and females, who are presenting for treatment with serious and life-threatening eating disorders. I'm often asked to give talks on eating disorders, particularly when it comes to school talks. While it's important to raise knowledge and awareness about eating disorders are a much broader public health issue. There are important findings from the research literature that need to be shared with families, schools, post-secondary education institutions, fitness center staff, primary care, and healthcare practitioners. An important breakthrough in research is that we now know that the period of early adolescence places girls at risk for developing disordered eating that can be very disruptive. Simply being female and going through early adolescence is a risk factor for disordered eating. When you think of it, it's the perfect storm. The period of rapid physical growth associated with puberty, necessitates natural increases in body weight and fat. This sets girls apart from the unrealistically thin images they see in the media. Living in a society that overvalues thinness at the same time that girls experience an increased desire for peer acceptance and wanting to fit in leads them to second-guess themselves. And it's during this stage of development that girls trade their own opinions for the opinions of others. Trying to control one's weight through unhealthy dieting and other means becomes a way of coping with these normative stressors. My first goal was to develop prevention strategies that could be shared with young females during this stage so that they could replace dieting with stress management and other helpful coping mechanisms, ones that would promote good self-care. I then set out to find ways to introduce these strategies to girls before or during middle school for it to serve as a vaccine of resilience of sorts at a time when we know that all girls are vulnerable. This is a good example of needing to provide prevention at the right time and in the right place. A next goal was to broaden the prevention work to include male youth, parents, teachers, school personnel, and to work with the larger community to promote a supportive environment for all children and youth, one that is free of weight bias, negative comments about weight and appearance, and one that helps children cope in a way that allows them to thrive. What is proving to be a strong predictor of success for youth is having a sense of belonging and connectedness to their families, peers, and schools. This overrides any health information that we share with them. Some of you who have teens at home may think that they've traded you in for their friends, but rest assured, we know from research that teens continue to value the support of parents and adults in their lives. In fact, having a strong connection with just one adult in your life is showing to be a strong predictor of positive youth development. To quote Dr. Bruce Ferguson, a leader in child and youth mental health and a mentor to many of us, "Show kids you care" is a motto that we should all abide to. On a personal note, one of the pictures in the video is of my sister and brother standing on either side of me, taken a few years ago. Both have held positions as chief executive and chief operating officers in the healthcare and in the IT fields. Leadership seems to run in our family. Our dad was inducted into the Sports Hall of Fame at McGill for his contributions as a football player, football coach, and builder of the Alumni Association. Throw into the mix our mom's French-Canadian culture and joie de vivre, and you get an even stronger blend. We hope to pass along some of this leadership to the next generation within our own family. We currently have 5 emerging and young adults whom themselves are going through the wonderful phase of wandering and wondering as they contemplate their career paths. I have to credit my husband, who graciously agreed when our daughter was first born to read through my textbooks on female psychological development and on how to raise an adolescent girl in today's society. Prevention can never start too early. This month at her high school commencement, she received an award of her own for leadership and strong character. So she's off to a good start as she herself starts university this fall. But a sign of good leadership is ensuring that what you build or create sustains itself over time and continues to thrive even when you are no longer there. So once again, I look to Bruce Bryden as an example of true leadership. His passion for the university lives on through these awards and through tonight's celebration. I hold as an important goal for myself to do the same within my field of eating disorders. We need to continue to break down the silos that exist in our healthcare system and to value the perspective of individuals with lived experience and their families. I'm very grateful for the advocacy provided by the founding members of NEED, the National Initiative for Eating Disorders, who are here with us this evening. So I want to extend my congratulations to my fellow Bryden Award recipients, whom we're celebrating next, but also give a heartfelt thanks to the Alumni Association and to the university for both recognizing my work, but also for welcoming me back into the York community. Thank you very much.